Meanwhile, coronavirus cases and hospitalizations are surging at an alarming rate in parts of the country. And as we head into colder months, the nation's top public health expert, Dr. Anthony Fauci, is warning that Americans should double down on efforts to contain the virus.
What we're seeing, unfortunately, is upticks in case positivities, test positivities. That's going to translate, as it already is, into additional hospitalizations, which ultimately are going to translate into additional deaths. And now we're starting to see, as you said correctly, an uptick in cases, in 37 states. I mean, that is a substantial proportion of the United States of America. That is not a good sign as you're entering into the cooler weather. So what we really have to do is double down on the things that I talk about every single day, the 5 issues: universal wearing of masks, keeping a distance, avoiding crowds in congregate settings, trying to do things outdoors, preferentially over indoors, and washing your hands frequently. They sound very simple, but people are not doing that. And that's the reason why we're seeing the uptick in cases.
On average, over 50,000 new COVID-19 cases are being reported in the U.S. every day, a mark the nation has not seen since mid-August. Most of the current outbreaks are in the Midwest and Northern Plains, like in Wisconsin, where a new field hospital opened yesterday as the rate of infections continue to soar across the state. The medical station, located in the State Fair Park, comes as more than 1,000 people have been hospitalized from the virus, overwhelming hospitals. The 7-day average of positive cases is currently the highest it's ever been. 246 of those hospitalized remain in intensive care units at area hospitals. The medical station will be staffed by healthcare workers from across the state and country. It will serve patients with COVID who suffer from minor symptoms, like also in Iowa, which is seeing an uptick in cases and hospitalizations as well. A reported new high for the second straight day. The latest report confirms nearly 1,200 new cases. Yesterday, 11 people with COVID-19 were confirmed dead in that state, bringing the death toll to above 1,500. White House coronavirus experts have urged Iowa social gatherings to be limited to 25 people so people don't get the virus and die.
So again, in the state of Iowa, Donald Trump's White House urged Iowans to limit all gatherings to 25 or less so they could protect themselves, protect their loved ones, and especially protect senior citizens, because, of course, we've seen it at colleges, we've seen it at other places where young people go, they go out, they're surrounded by others, they bring the virus back home, they're asymptomatic carriers, and they send a parent or a grandparent, they send a senior citizen to the hospital. So you had Donald Trump, Jonathan and Lamir, while we're showing these images, you had Donald Trump giving the advice from his White House for all Iowans to limit gatherings to 25 people or less because Iowa's moving towards a hotspot, being a hotspot. And look at that crowd last night in the state of Iowa. It is shockingly irresponsible, of course. Donald Trump proves again with this image he does not care whether people live or die. He only cares about his own political fortunes. That's all he cares about. And even the biggest Trump supporter knows that to be the case. And yet Donald Trump brought thousands of people together, packed them together, most not wearing masks. The same time, his own White House is begging people. They're begging people in Iowa to not have more than 25 people together. I'll ask the same question I asked last hour, and I'll open up to anybody else after you, Jonathan. Does Donald Trump and his campaign team not realize what this does, not only to senior citizens in Iowa, but also in Florida, in Arizona, in North Carolina, in Pennsylvania, in Michigan, and in Wisconsin? It scares the hell out of them and shows that even after getting it himself, Donald Trump is not serious about this plague on seniors.
Yeah, Joe, and let's start there, how his messaging after his own diagnosis, after his own illness, has not changed whatsoever. He still downplays the virus. He talks up the treatment he received, mind you, treatment that most Americans can't get. This is experimental stuff that he received at Walter Reed Medical Center, and he says, well, I felt lousy for a couple of days, and now I'm fine. I'm back out there. And so, you know, he did a poll the other night and asked how many other people in the crowd may have had the virus, and said, well, we're all still here. And I think that's sort of the messaging they're trying to suggest, is that the virus is something that we live with as a nation, and then try to move beyond. But these images last night, there was 6,000 odd people there, according to reporters on the ground in Des Moines. They just fly in the face of course, the White House guidelines for Iowa, but also just where most of the nation is right now on the pandemic. And that's why seniors are so spooked. That's why he has seen a real hemorrhage in support among seniors, dating all the way back from the spring, when he'd have those scattershot daily coronavirus task force briefings, one of which where he said that he suggested injecting disinfectant as a treatment for the virus. That's when his campaign first saw a real drop in support among seniors. And as much as he is trying to project the idea of normalcy, the idea of the nation turning the corner around the pandemic, despite the fact that thousands upon thousands of people are still being infected every day, you know, that it's not working. People see those images and they are frightened by them. That's not what they want to see. That's not where the nation is right now on the pandemic. And that's a calculation that his team has made. And it's certainly, you know, it may bolster the enthusiasm of the people we see thronging in those rallies night after night, but it's going to hurt him elsewhere. And that's going to be support among seniors, among suburbanites, among women, that he may have a really difficult time winning back here in the last 3 weeks, because it's that recklessness as a final point that he himself, that's why he received, his aides acknowledged this, that they saw polling data after his own diagnosis, that though there were public sentiments of support, and everyone, of course, wished he would recover, other times when American presidents have had crises, the nation sort of rallied around them. When President Trump was diagnosed with COVID-19, there was none of that. And the sense was a lot of Americans felt like he brought it upon himself by his reckless behavior, ignoring the guidelines of his own government.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.